With that. All right. Welcome everyone to part 2 of the microdosing webinar. This is super exciting. CJ is going to be hosting this talk. We had a really awesome session last time, and I think it's going to be just as good. I'd probably say today it sounds like it's going to be better. CJ definitely saved some more of the juicier tidbits to talk about today. So that being said, though, really excited. A couple things on housekeeping. So we did mention giveaways and such. So we're going to reserve those to the end, so that way people don't, basically stick through the webinar. So we'll be announcing the winner of. CJ's giving out a signed autograph copy of his new microdosing guidebook that is just released. We're also giving away a super limited edition supply Terrashroom hoodie as well. And then also we're announcing the winner of the mega Terrashroom giveaway. So that's going to be a Terrashroom grow chamber. That's going to be 3 months of free cake plus some swag. So lots of giveaways there. But CJ, really excited to have you, and going to pass over the mic to you so you can fire off.
Awesome. Well, I want to welcome everyone to part 2 of this. We had some issues here last week, so we ended up, I had an extra week to throw some more juicier stuff in here, which is going to be really exciting. I think going to cover some great topics here. Let's see. As I'm going here, I got my PowerPoint to bring it up. So I want to remind people this is a presentation is intended for educational purposes only. As being such, myself, Terrashroom, no one else are condoning the purchase, sale, or transfer of any illegal substances, nor do we condone or encourage partaking in any unlawful activities with these illegal substances. This is also intended for being educational purposes only. This is not a substitute for professional medical advice, diagnosis, or treatment. Always speak with your mental health or primary care provider before changing anything. I'm going to be talking about some non-FDA approved substances here, which hopefully will be changing here in the future. And I have no disclosures particularly to discuss. So with that, wanted to also let everyone know that as we're going to be looking at this, I'm going through last week's slides real quick to get up to where I am. Want to let people know that I'm really excited about this. A little bit about myself here. I am CJ Spotswood. I go by the name of the Entheo nurse. I'm a psychiatric nurse practitioner here in Maine. I've been working as a psychiatric nurse for over 20 years. In the last 5-6 years now, I've been really focusing heavily on psychedelic medicine. I've been working with a couple of different companies, including Psychedelics Today. I've done works with psychedelics.support. I'm also recently finished the CIIS, California Integral Institute of Sciences, their certificate program for psychedelic therapy and research. So I've really been hammering away on this psychiatry mix with psychedelics for a little bit of time. This one also, I think, really exciting is get to talk about some of the topics here in my book, the Microdosing Guidebook. And as Jared said, we'll be giving one of these away here at the end of today. Wanted to let people know here, the other part of this PowerPoint, I'm coming from a risk reduction approach. So I'm going to be talking about some substances that are illegal. If people are choosing to go into using some of these, they're going in on their own. I'm not giving medical advice. Like I said, I am not your medical provider. And that's where having these conversations with them can kind of look at individually what you may want to do to optimize outcomes, and which is the purpose of why I put together my book. I talk about how to talk to your healthcare providers about psychedelic medicines and give them resources so they can learn, because many of them, like ourselves, have grown up in this era of the war on drugs, and this is your brain on drugs. If we think of the brain, the egg going into the frying pan, we're dealing with that just as much as the providers are. And I'm going to go over a little bit of that and why it's different. So when I talk about psychedelics specifically with the other one, the other name, the fun ones, I'm not going to be saying the word psilocybin much because I don't want it to be popping up on any sensors that may shut down on any of our platforms that I'm meeting here with. So I'm going to refer to them as medicinal mushrooms from this point forward. But make no mistake, I am talking about psilocybin. And I'm not talking about Amanita muscaria, the magic mushrooms that are growing out there. Those are completely different and different substances. Um, and I come from what I refer to as a risk reduction because I think that the thing to remember with these is there isn't any inherent harm. There's some risks that are involved with using these substances, but there's no inherent harm. So we can use ways to safely go about this to reduce the risk that's involved. And I think that's kind of important for people to think about because um, as we're changing the stigma that's around that and having these conversations more openly, people are not so well versed, especially healthcare providers. Like, how do I even talk about these? And it's changing that dialogue when we get people more comfortable with it. So we're starting right in here. Want to mention, this is not this. Don't call it a comeback. Um, LSD and other psychedelic drugs were once experimentally used in psychiatry, but people didn't realize how much. That's why it's this misnomer at times. People are thinking this is a new movement and new craze. During the 50s and 60s, there were more than 1,000 clinical papers published that were discussing more than 40,000 patients using um, psychedelic medicines. Over a dozen books, several dozen books were published, and there were 6 international conferences on drug therapies, trying to figure out how do we go about using these. We know what they're doing a little bit, but how do we make this and change this and kind of fit into the medical model a little bit for treatment? And the other thing I want to say is, I'm not saying that with my background being a psychiatric nurse practitioner, uh, I think that there's plenty of other ways of going about using these substances that are outside of the traditional medical model. I do come from that is the area I know most about, but I think group work, self exploration, the betterment of well people, spiritual use are all more than appropriate ways of doing it, and that's part of that risk reduction is trying to improve that. So. And I want to encourage people as I'm talking and going through, I don't have the chats necessarily up here to read what's going on, but that's what Jared and the team are doing is between all of the different platforms, going in and covering all of the questions that may come up to ask toward the end. So if questions pop up during the middle of this, please put them in there so we can come over them after, okay? So, want to mention here the current pharmacological treatment of psychiatric care is merely palliative attempts to address the symptoms and to reduce the suffering. It's not actually curing it. The medicines that we have out there, um, like standard treatments like antidepressant medications, mood stabilizers, uh, even the antipsychotic medications that are used for schizophrenia and treatments are not actually curing. It ends up reducing some of the symptoms that people are having, like the symptoms of depression and low mood, helping to decrease anxiety, but making us more tolerable of the world around us. Um, and oftentimes, when people will stop taking their medications until they've made those other changes in their life, the symptoms will return. So, really, the 3 main neurotransmitters when it comes to psychiatry in general are serotonin, norepinephrine, and dopamine. And I'm going to be mostly focusing here on the serotonin. That's the one that is most often associated with mood and helping to alleviate depression. And if you kind of take a look at here in this graphic, you can kind of see on the far right there's a picture of the serotonin molecule. And next to it, there's the molecule of psilocybin and the molecule of LSD. And you can see how similar they actually are in treatment and why they work so similarly in there. And you might be asking, why am I talking about LSD? Um, Part of it is most of the research that was done in the 50s and the 60s was using that, but now because of the social stigmas around it, we are really looking at psilocybin being used because there's less social stigma, B, the effects are very similar on so many ways and how they unlock, but it's also doesn't last as long. Where psilocybin might be a 4 to 6 hour journey, you go into using the LSD will be sometimes up to 10, 12 hours. So it's much shorter in that sense for many people, making it a little bit easier to manage and treat in that time. So that's kind of one of the big things wanted to say here. Serotonin is the receptors are found about 90% of them in the GI system. With that, that's why sometimes with stimulating the GI, we can end up having those other symptoms like upset stomach, nausea, constipation, diarrhea, things like that, which happens with sometimes with taking some of these magical substances. But also when it comes to medications like antidepressant medications, SSRIs, till the body starts in getting used to those being stimulated, sometimes people have some pretty profound GI upset, which is why people will often quit taking different things. And I'll talk about how to kind of mitigate that when it comes to the topics we're talking about here today. So, canalization versus neuroplasticity. One of the things that we really like to mention here is when we think of depression, we think of anxiety, substance use disorders. A lot of them have a lot of overlap of symptoms, and a lot of the overlap of symptoms are also the overlap of ways of treating them. Oftentimes, you have in treating someone with like a substance use disorder, there's usually a co-occurring anxiety or depressive symptoms there, and with treating one, you're in turn treating the other. Um, when I say canalization, it's one of the things to talk about here is we think of what is that? A canal. It's where something moves in one direction, very narrowly focused. Uh, And in many ways, with those maladaptive ways, when it comes to mental health issues, there's a canalization. There's a way that individuals can't see things differently, see things in a different pattern, see things in a different way, and versus the neuroplasticity, which these substances can do, and changing the way that the body is physiologically working and the different connections within the brain, but also with that changes the way that we think of ourselves in the systems around us and the world around us. Um, so really, there is a huge overlap, and I think that sometimes we need to kind of think of that and why that there is. So with that canalization, oftentimes there's rigid thinking that's associated with it. Like I said, the depression, anxiety, PTSD, OCD, substance use disorders, and even in some aspects, like the way that we socialize and relate and connected with others, um, including the like with autism, things like that. Um, we've seen low doses of psychedelics help with these symptoms. We've seen a lot with high dose as well, and I'm going to talk a little bit about the differentiation of the two. So, one of the things to talk about here, the standard treatments, refer to standard treatments here being like SSRI medications, treatment as that. Um, in the how they work is with the serotonin system, like I said, and in this graphic, which I ended up using here, um, was based on the Tale of Two Receptors by Robin Carhart Harris and David Nutt. And this graphic comes from my book. And where these are different. So antidepressant medications typically act on the serotonin 1A receptor. They they impart change by decreasing impulsivity, aggression, anxiety, emotional response. So pushing down the emotional response, which in turn will enhance resilience, patience, and stress tolerance. As such, it results in decreased symptoms of depression and having an increased sense of well-being. Now, when we're talking about microdosing and psychedelics, what we see is there's reductions in rigid thinking, the breaking that canalization that I was talking about, and a reduction in pessimistic thoughts, which then in turn um, we have an enhancement in plasticity or thinking things differently, more sensitive to the environment around us, learning and unlearning behaviors, and more adaptable to change. and coping, which then in turn results in decrease in depressive symptoms and an increase in sense of well-being. So really there's two different pieces here of why it works differently. It ends up activating completely different on this um, other neuroreceptor of the serotonin, and then the cascading change that accompanies that. And other things that we've seen with microdosing and with full dose psychedelics, there's some changes in personality and emotional insight that's sometimes gained, increased in awe in aesthetic experiences. So people will experience the world around them and how they are in a different manner. And as such, that's where that change occurs. There's also some medical applications that we can kind of look at that I think that we don't necessarily always think about or realize that they're also that can be included here, and where these medicines can change. So with that, some of these medical conditions that we see can be potentially anorexia, which is known as the most difficult mental health issue to treat, and also with the highest mortality rate. Um, there's also and there's no approved FDA medications for it. Often there's treatments with like antipsychotic medications and antidepressant medications. Um, but the question is can we change the way that someone's thinking and improve their mood? And that's where the psychedelics can be so much more benefit compared to the standard treatments. Some of the other treatments here I'm going to talk about a little bit for medical applications are pain, such as rheumatoid arthritis, fibromyalgia, post-treatment of Lyme disease syndrome, uh, asthma. There's lots of research of old psychedelic applications, often in macro dose amounts for asthma, which people don't necessarily know. And going through some of the old research was actually interesting, seeing some of the journals which were really heavily focused on asthma and respiratory treatments. There was publishing a lot of publishment in there, and also other conditions that are associated with the inflammation response and inflammation markers. And I like to add here, when we're talking about the antidepressant effects, you know, oftentimes we do look at how the serotonin affects that in improving mood, but there's also many markers here that happen with inflammation, and we're starting to learn now of how the inflammatory response can affect mood, how it affects the brain gut biome and the connection there as well. And I'm interested in seeing, as we learn more of that, we can maybe find some more novel treatments moving forward, because we really, when it comes to the antidepressant medications, we haven't, like with without having even with Prozac, when it came around first approved in, I believe it was 87 or 88, there hasn't been any major treatment changes since then for depression. And even then, with the SSRIs that came around, that was based on the theory back from the 50s and 60s of where we had these older medications like tricyclic antidepressant medications and such. So really, it's always been that monoamine, being the serotonin theory um, of treatment for depression. So so I think that when we start looking at these other applications of neuroinflammation and neuroplasticity, we can see other ways of changing, um, such as the way that we think of pain or associate with pain, not only reducing the inflammation, but changing how it is. Sometimes with people with chronic pain will end up, really it becomes a part of their identity and who they are, and avoid certain situations in life as a result. I know this is generality, but sometimes asking someone with chronic pain, do you want to go do X, Y, and Z? Like, no, my back hurts too much. I can't go do this. I can't do that. Which then that rigid thinking comes in and self-limiting, and as a result, the mood can drop as a result. So I'm going to switch over. I'm going to jump back and forth a little bit from macro and micro, and I'll differentiate the two. But here with microdosing, I want to kind of talk about this a little bit, because I think this is something that, you know, isn't talked about enough at this point. I think it's going to be very exciting to see as it comes out more, and with the research that's going to be coming, and because it's exciting how we can do this. Partially because when I'm talking about microdosing, I want to really differentiate. It is the act of taking 1/20th to 1/10 of a full psychedelic dose. Um, Here, another graphic that came directly from my book. When we're talking about a full psychedelic journey of full dose mushrooms, we're typically seeing like 2.4 grams to about 3.5, which is equal to about an eighth of an ounce. Doesn't matter if you aren't up to date with your drug math. I'll just let you know it equals out to about zero point 0.1 to zero point 0.4 grams is a microdose. So it's a little teeny tiny amount. To note, 1 gram is equal to 1,000 milligrams. So it's a tiny little amount, and there's various ways of taking them. There's various protocols that people will follow because everyone is different, and I think that's where it's exciting to me with looking at microdosing is people can really take their health into their own hands and be an active participant in their journey. Let's hold on for a quick second here. Probably have a few questions before I move forward here. Jared, what we got for some questions at this moment?
Yeah. Thanks for making some time. So yeah, it was funny. We just had someone ask about the microdosing, so appreciate you already talking about that. But so we had a question earlier, and let's see, it was from Jackie. So Jackie asked, most care providers are not knowledgeable of drug interactions with alternative therapies. Is there any major interactions between any of the mushrooms and typical pharmaceuticals? What is a reliable source to look into drug interactions with mushrooms, if there is any, for other medical conditions?
Oh, real quick to give you a quick answer. There's not a lot of great research on them out there with both macro and micro. Um, and as a generalization, while also there is, I'm going to be like this is focused on these substances, not other ones such as ayahuasca, which has a lot of drug on drug interactions. But when it comes to psilocybin, there isn't a whole lot. Um, and in that, there isn't a whole lot that that are dangerously interactive. Um, so the big thing to realize is with if someone was going to be doing like standard antidepressant medications, the sertralines, the fluoxetines, so brand names Paxil, Prozac, Lexapro, Celexa, things like that. There's not any major interactions necessarily with the two. And one of the questions that people will say is, can it lead to serotonin syndrome? And the answer to that is no. They work on the completely different pathways, and microdosing does not build up build up the serotonin in the brain in there like the antidepressant medications do. The way the antidepressants work is they not only with the increase of the serotonin that's going in there, it blocks the breaking down and the re-release of them. That's why they're called selective serotonin reuptake inhibitors. They're not, they block the reuptake or the taking out. So in between the pieces of the in the brain, there's floating around, and it increases the amount that's freely there, thereby, in theory, lifting mood. The
Mm,
antidepressants, when it comes to microdosing, it doesn't do that. It acts on that 1A, which has the other cascades, but you're not artificially, or I don't want to say artificially, I don't have a better word though, increasing that serotonin that's there. It works completely different than that. The biggest interactions that you might see though is sometimes the antidepressant medications can block some of the effects.
mm,
So sometimes you have to go a little bit higher than the standard doses to kind of get around it. I was talking to a patient who recently did a high dose psilocybin journey, and she is on antidepressants. And she said that when she was out doing them, they did not stop them. They kept them on there. And for her to get a full breakthrough journey, she ended up actually eating 10 grams of mushrooms to get around that, which is
Wow.
a extraordinary dose. Um, but there's other people who will take them and they'll be on the same things and it doesn't block it. So it's kind of a here, which one is it? And it
Mm.
comes down to the question also of with stopping them, is it worth stopping the antidepressant medications? Because as a result of that, of stopping them, we can see increased suicidal thoughts, increased depression, increased anxiety, discontinuation syndrome, which include, depending on some of the medications, having experiencing brain zaps, things like that. So I think it's really important to look at the risk benefit of continuing them. And always strongly encourage people not stopping their meds without talking to their provider first because of some of the side effects that can come up with it.
Mm.
There are some other medications that potentially can interact, but most of them are blocking some of the effects as well. The big one to not use with either microdosing or macrodosing would be lithium. Lithium would be a no-go because so I'll say this based on a lot of the research that we have of where these potential interactions come from. We don't exactly know because no one's doing these direct studies. So we have to kind of look at what has been published in the past, and then when it comes to with microdosing, extrapolate if the high dose is potentially not good. I would probably avoid doing the microdose along, for that same reason.
So
Um, and I really went over a lot of this in the second part of my book, the microdosing guidebook, for people to kind of not only feel comfortable how to talk to their provider, but then to telling providers, here's the research that's out there, and here's where I'm basing this off of. And then you can go back, because I cite all of my sources, go back and look at them and go and read for themselves, that they can
mm.
see it and go, oh, here's how I can go about doing this.
So, yeah, first off, and we'll include a link to his book for anyone interested. We also are giving away a signed copy, so short little plug right there. So a couple things you mentioned serotonin syndrome, and I'm sure there's a lot of people on this that are probably wondering that might not be familiar. Can you
Yes.
what exactly is that?
So serotonin syndrome, it's a deadly syndrome. It can be life threatening for someone, and really I'm gonna tell you some of the symptoms of it can be increased agitation, restlessness, insomnia, confusion, increased heart rate, increased blood pressure, dilated pupils, muscle coordination issues or muscle clenching, muscle rigidity, and it's from taking too many, having a buildup of the serotonin, which typically doesn't happen with standard treatments. You know, but when someone is on numerous medications that can increase serotonin or block the reuptake of serotonin, that's when a serotonin syndrome can come. So if
Mm,
someone is on numerous different antidepressant medications, sometimes with medications that get added in there, sometimes like tramadol, that's used as a pain medication. When someone is on some of the over the counter medications that can interact as well. All of them together. Also, herbal medications like St. John's wort. People go, oh, it's herbal. I can take this. Yes, but it also works on the same thing. And all of them together makes a soup of a problem that can be life threatening.
mm,
Serotonin syndrome is also um, sometimes seen. That's why if someone's going on a ayahuasca and go on a dieta to come off of their meds, it's because of some of the substances in ayahuasca that prevent the breakdown and that it gets built up. That's why someone has to be off all of them. And that's
mm.
where psilocybin is sometimes easier, more manageable because you don't have to necessarily do that. And because of like I said, um, the psilocybin working on the 1A and not boosting the serotonin in the brain, it is unlikely, and there's been no reported effects of serotonin syndrome with either macro or microdosing of
psychedelics, that being LSD or psilocybin,
Hmm.
documented. There's nothing, and I really think that if we were seeing that, and if it was happening, especially as hot of a topic that this is having moving forward, I think there would be a lot of researchers or people who would like to cite some of this and make this a case for this to go against why these are not safe, and we're not seeing that either.
Hmm.
So
So, and I think it's interesting you do bring that up, because going on to just a couple other questions. So, Gabe asked, so he was asking about, when microdosing, what does it pair well with besides lion's mane? He asked turkey tail. I know last week you did talk about this a little bit, stacking lion's
yep.
mane and basically cubenzos or psychedelic varieties. What, can you talk about that for a quick second?
I can, but I have a slide for it at the end.
Okay. All right.
Yep.
We'll do that. And then a couple other questions quickly, so we can get back on the slides. So let's see. Jackie asked, anything to worry about with interactions among other classes of medication like beta blockers?
Not specifically. They're really, because they all work so differently. There is not any anything that's really there for interactions. Occasionally, sometimes people would end up taking a beta blocker such as propranolol before taking macro doses to help with some of the physical symptoms of anxiety that are there. But generally, overall, they are pretty well non-problematic. You grab me a towel.
Awesome.
So,
And
yeah.
I think one other question that we had that I think was really, really good. So Jacob Gilman asked, what would you recommend for helping to slow early dementia?
That specifically, I think that microdosing can be a huge help for that. That's where actually in my next couple of slides, I'm going to talk about that and why microdosing might be really good for dementia. And I'm going to talk about actually a a person I was talking to at one of my book signings with some of their real life experiences.
Yeah, that'd be great. Okay, so I think we got through some of the questions that we had. So let's get back on track to some of the slides. Thanks everyone for asking. Definitely keep the comments coming in. I think we love to hear what questions you have. So yeah, keep going, CJ. Thanks.
Okay, perfect. So why might someone want to microdose? You know, that's there's really three reasons: better performance, relieve pathological conditions, and stop pharmaceutical medications or other drug use. And we think about better performance. What does that mean? Increased creativity, increased focus, um, opening one's mind to seeing different ways of doing things and finding creative ways to problem solve. Relieving pathological symptoms such as depression, anxiety, pain reduction, migraines, substance use disorders, ADHD, and stopping medicine use um, or drug use. We look at that. Some people have come off of their antidepressants and cross tapering over, or other things such as ADHD medications, things like that. Or if someone's mood improves with using microdosing, they might end up cutting down the other drug use that they're doing, um, such as drinking alcohol, cannabis use, things like that. So, so some of the things specifically with performance improvement, ADHD, cognition, creativity. Um, at one point, I know Fadiman had talked about how Albert Hoffman had felt that drug companies would really want to start investing on microdosing L specifically because of the increased focus and concentration, and had thought it would become as popularized as the methylphenidates or amphetamines such as Adderall for that purpose. As we know, it didn't really come out. Um, Microdosing can help aid with increased flow states and hyperfocus. So helping the people get into that ability to focus on a project or think of things and really not realize that they're getting into that, and the lack of understanding of time. You just lose track of everything when you hit that flow state sometimes. Now, there isn't any specific research that's been published with ADHD, but there's a lot on focus and concentration there. And there is actually one drug company that is looking at doing some phase 2 clinical trials for this purpose. Microdosers have reported research between like 14 and 61%. I know it's a huge margin, having improvements in attention and creative focus. So the proposed effect of microdosing, like I said, decreasing that neuroinflammation that changes in the biome. That's through the through doing that, we end up having these cut downs of it. Uh, and that one of that ways is by increasing the BDNF, which is one of the factors there that's part of the markers for inflammation. Let's see. It, some of these effects with that BDNF, which is the brain-derived neurotropic factor, are dose dependent, but only to a point. So hypothetically, at least, if someone's just microdosing with it, they might have the same results as someone with a macro dose, especially if they're doing it more short term and more frequent. Neuroplasticity, there's changes in the physiological construction of the brain and how it's all connected. And we start seeing increased dendritic growth, which is a part of the neurons of the brain. And the actual growth there, which do slow as we age and slow or get smaller with numerous numerous neuroinflammatory things such as Alzheimer's, um, Huntington's. And I'm going to talk about those here directly here on this next slide. So the applications, like I said, for that neurodegenerative conditions, Parkinson's, Alzheimer's, multiple sclerosis, um, ALS, which is also, I'm not going to try to pronounce it, Lou Gehrig's disease, and chronic traumatic encephalopathy, which would be repeated hits to the brain, which is common. One of the people that were really interested in looking at that was Dana White, and looking at how this might be something for um, ultimate fighting, where in the UFC, because they're taking those chronic hits to the head over and over, or boxers, um, and also football players, those hitting of the heads from in their helmets over and over and getting their bell rung, and also veterans. So when we see this, the decreased inflammation, improvements in neuroplasticity, and speaking specifically for Alzheimer's, dementia, things like that, there's not any real great treatments out there. All of the medications that are out there to treat those types of conditions are yeah, the Ariceps, things like that are very costly, and you need to start treatment early. And by the time many providers are even looking at and interested in thinking that's what they need to be treating, it may be so late that they're past, because they don't fix anything; they just slow down that progression. And with Alzheimer's, um, if that's the case, where people are losing out. And when it comes to, so there was an example. I was at a book signing last year, and I was talking to a woman who was telling about her husband who had had a stroke. He'd lost complete use of his left side, um, not able to walk, and he also had temporal dementia, which is the dementia that happens where the brain's not getting enough. When the brain doesn't get enough of blood going to it and oxygen, there's more confusion and more agitation that comes. And so sometimes the standard treatment for the dementia piece is the antidepressant medications, because then if they're less anxious, less upset, the brain is still getting the adequate blood going in, so that way they're not losing out on that. So he ended up going through, after he had a stroke, went through standard treatments, and his neuro team had said, after the end of the standard treatments at the end of the year, you will probably, whatever improvements that you have had will probably be the best you will ever get out of the rest of your life. Past that, it's not often that we get much more improvements as a result. And when they heard that, they were kind of upset, and decided we have
nothing else to lose, they ended up illicitly obtaining chocolate bars online and started to microdose. And within 2 weeks, started seeing improvements. Less than a month, he actually regained strength on his left side, was able to start walking again, and had improvements in his mental state because of the improvements overall. Now, I can't say, looking at and doing the research on it, like, did he do it? I don't know. It wasn't a study, but hearing these stories over and over again, talking to many, many people, it makes me believe that there's something here that we're missing and research is missing in general. So I think that that's where, if we can get some of that improvement there, hugely beneficial for people. So,
Wow,
yeah,
that's incredible.
it was. I mean, and as she was telling me, she was just tearing up, hugged my wife. It was really amazing to see just like that story of the change that was there. So reductions in pain as a result of microdosing, it may be beneficial as a novel approach because of some of the anti-inflammatory effects, but also changing the perception of the pain, how we associate that pain and the rigid thoughts that are there. And there's also not having that dopaminergic response, that dopamine response, that feel-good response that comes from using chronic use of opioid medications, which is where the addiction piece comes. Um, these medications don't do that. They don't have that. And in studies that they've given this to mice with feeding water, they do not return to come back for the substances. So they're not getting that addictive property there. And there was a study, Remekers, came out in 2020 where they were using microdose amounts of LSD for pain. In that study, they would submerge their arm in ice cold water, and the longer you could submerge the water, the more pain resilience that you had. And participants that had received that low dose, that microdose of LSD, were able to keep their arms in for 20% longer, both 1.5 hours after administration and 5 hours after administration, that compared to people who were receiving a placebo. So there leads me to believe that there is something there that is happening. Um, and this goes back to the research of Dr. Robert Cast Dr. Cast back in 1973, giving full dose psychedelics for pain, um, and seeing the reductions there. There were people that had cancer, terminal cancer. Another application I think that might be interesting for that pain reduction is individuals that have PMDD, um, premenstrual dysphoric disorder, where it helps both the symptoms where there's increased depression, irritability, anxiety leading up to menses, but also can help block some of those physical symptoms such as the cramping, fatigue, bloating, and headaches. Many times treatments for that is maybe increasing SSRI medications along with anti-inflammatory meds up until that week prior. Um, and the both of them do hit the serotonin and the anti-inflammatory effects, so that might be another application that might be interesting. There is also some good research that's been done on individuals with cluster headaches, also known as suicide migraines, because these migraines are unbelievable. The migraines are when people have an individuals experience two or more daily headaches for more than a month. Typical treatments out there are ones that work on the serotonin. But they've found that doing both microdoses of LSD and psilocybin have had results with that. And I give the exact study and the protocol in my book for individuals. As such, groups such as Cluster Busters have looked into starting to decriminalize these medications to help improve that. And what's interesting is there's also a company there's a few companies looking at doing some phase 2 clinical trials for use of low dose psychedelics for this, which if they can get that, and if they can get an approval for that, it would then prove that these do have a medical reason, even though we already know that, thereby not by definition not being a part by not should not be on the schedule 1 for
being a controlled substance, but also if these can come to market at these low doses, it would then open the floodgates to off-label use where other people could then prescribe them for other applications, physical applications. So, so there's some really
Incredible.
great research coming back. This is actually a picture of my office at work of using psychedelics and microdosing to help as an adjunct to therapy because it can increase that connection with others, and then changing the perceived concrete thoughts around what's going on around us. Um, there's some pretty decent research that was done early on, and one of the people that were strong proponents was Stanislav Grof, who in LSD psychotherapy in his book talks about individuals using low doses for psychotherapy, microdoses, and helping to bring and have that connection and feeling more connected with others and talking about things without having such a negative response and seeing things differently. Um, Less patterns and rigid thinking, less excitability, and individuals can process emotionally and the unconscious and think about what they're getting a response in a better way. And sometimes people do that with antidepressant medications as well. I mean, it's the 1-2 approach. So it would be very interesting to see how it's there and making, because they can kind of seem to be more, make the brain and the topics more porous and bringing things about to the surface more easily than just kind of being shut down and locked out, which is sometimes what happens with different treatments and different therapies and ways of approaching. So real quick, I'd already addressed the serotonin syndrome. One of the other topics people sometimes will ask about, if there's cardiogenic concerns based on the idea of the serotonin 2B receptor. There's some studies that's been done. Um, we've seen that 2B receptor, there's other medications that have been known to cause the chronic stimulation of that 2B receptor. And during that time, one of them, it was the drug fen-phen. It was one of the two phens that's in there, was causing some valvular heart defects. There was also a headache medication that was out for the same thing that was causing these issues. And at this point, there's no real great research saying that there is, that there isn't. I know Dr. Kalen Thomas has talked about it in a couple of his talks, and also spirit pharmacist Ben Malcolm has talked about it, and as a hypothetical, but we haven't seen this yet. And I don't, my heart of hearts do not tend to believe that this is going to be something that we've got, because of the fact that with microdosing, it is such a small amount, and there's people using these substances daily for a long time, like going on tour with the Dead, things like that, that we're not having a problem. So other considerations to think about: the legality. These are Schedule 1 substances. So even if you are in a place that's decriminalized, it just means that it is less likely to be having the police or authorities going into to crack down on that. But then again, I've also been a part of some court cases with people that have been caught with amounts that they were using for microdosing and had to go through the headaches of that. So that is probably the biggest side effect that's potential with microdosing, is the legal piece of it, and to each their own and what they want to do for addressing that. And but I've had plenty of patients who have gone about doing it because they feel the ends justify the means and have done really well with it. So one thing to think about is dosages can differ for the amounts of psilocybin inside of the mushrooms from batch to batch, even from cap to stem. So if someone was to go about, you know, grinding them down and taking them in a manner that's mixed, it can have better improvements that way of uniformity. Um, and if someone does change, obtains them, and each batch from wherever they obtain them could be different slightly, so they might need to redose and figure out what their individual dose is after they do it, if they do a dosage change. So how does someone go about microdosing? There is lots of information out there, including my book. There are 2 protocols that people often will go, being the Stamets or the Fadiman. And in my book, I really focus on the Fadiman protocol because I think it really helps people to have that gain a relationship with it. Take a dose on day 1, the next day reflect on how they felt doing it. They might still feel a little bit of an effect the next day. Day 3, not take it. Day might not be as great, but it's a dose of reset. And if it's not that great, they know that the next day they can dose it again. The Stamets goes oftentimes like during the week, 5 days on, 2 days off. So here's a picture of the Fadiman protocol from my book. But I think it's really helpful for people to go doing some journaling in there and to kind of realize, being mindful. What am I feeling? What am I seeing? What am I doing? How's my concentration? How am I feeling about it? Because if they wanted to, as they're doing it, then if they start at a low dose and feel like they're ready to go up, they could. And that's where it's really helpful for that. So finding the personal dose, start low, go slow. Um, Sometimes someone that's a smaller body mass might want to start at a lower dose and slowly go up because you can't take it away once it's there. Oftentimes side effects such as nausea, things like that are dose dependent. So the lower dose often have less side effects. In my book, I do have a handbook piece for people to find out what their mood is and track it so they can individually find what their dose is. Taking into consideration, someone's taking caffeine. Sometimes, because of the stimulating effects of these medicines, 1 + 1 = 3. Sometimes taking with food and drink can help with the nausea. Uh, Occasionally, I've seen a couple of people who will take them and they don't get that stimulating effect. They get tired, and for them, they would dose it at night, which is the same way going about treating with antidepressants that make someone tired. So there's lots of information out there to go. One of the questions I know someone had about stacking. Uh, about a month ago, Paul Stamets stack ended up getting approval by the patent office, which is taking a low dose psilocybin, oftentimes with lion's mane. Lion's mane having that piece that we were talking about last week, of why it can be hugely helpful for people because of the increased memory, focus, concentration, the anti-inflammatory effects, and the mood, and helping with the gut. And then the niacin that's there, which does cause that skin sometimes flushing feeling, burning, and why someone might want to go slowly with it. But the idea of that taking the niacin with it is to help open up the blood vessels to push these both the psilocybin and lion's mane into the rest of the body, and also to help cross the blood-brain barrier. That being said, let's open up some questions. I know we're getting close on time, and I hope that I hit some questions in those later slides.
All right. Yeah. Wow. Responding to comments and just first off, this is really incredible. So I think definitely quite a few questions that people have. So let's back up to some of what we
And I want to
had.
remind on part 3, which we're going to look at doing here probably in 2 weeks. I'm going to really go light on the topic and do a lot of questions there too. So if people want to really get some good Q&A then, and or review this and want to go over some of it, by all means, part 1, part 2. Well, I'm going to open it up to be more questions taken. So
You mean part 3 or?
yes, part 3. Sorry.
Yes. Well, first off, a lot of incredible information. I think there's a couple ones that, and some of these might be your own personal experience or just things that you've maybe noticed with patients. But so Jason asked, so for many who are struggling with addiction regarding opioids, could microdosing be a safer alternative?
I think so. I think it would be a good. It could be, as a risk reduction. It might be a way to not only help maybe reduce some of the inflammation and the pain that's going on there, but also the way perceiving the pain and changing, the um, or the approach to having, if it's like a opioid use disorder where the addiction piece is there, it might change the why they're doing it, helping with the mood, but also helping adjust to it.
And then oftentimes, with the substance use disorders, there's so many overlap of other pieces of feeling lonely or isolated and not having anyone there. Here are these substances that can help feel more connected with others as well and help bring up a community.
Right. And I think one thing I mentioned this in the comment, and for those who might not be watching the comments, it's interesting because I read something a while ago that the founder of Alcoholics Anonymous, he basically in the early days he was pushing to integrate psychedelics within the treatment protocol because he saw such incredible success. So I think not only could it be a replacement in terms of pain relief, but I think it's definitely safe to say that in terms of addiction, whether it's alcohol, tobacco, and maybe a harder substance, whether it's like opioids or amphetamines, like definitely seen a lot of success in some research that's been done. Okay, more questions. So Terrell asked, so is this is better than Kratom? I've heard of it, but kind of don't like the name. So anything you can talk about that, CJ, Kratom?
I do a talk. I've done a couple educations there on Kratom specifically. It's the challenge when you start getting into looking at substances such as Kratom, like how pure is it? Does it have the standards of coming across? Because sometimes some of the adulterants that are in it are from poor equipment grinding it down and breaking it down. So making sure that the clean standards are there. And with Kratom, there's some they do potentiate other substances. So if someone is already using either benzodiazepine medications or opiates concurrently, they can potentially one each other and can lead to overdose. That being said, even with Kratom, as a risk reduction, harm reduction approach, is less likely to have something than a someone who's using what they think is heroin, but actually being fentanyl and then overdosing. So I think there's a way that we can look at using these things together concurrently. There may be some ways of having a microdosing and then using Kratom during the day to help with the rest of the pain. That's the piece there, but only need to microdose once a day. That might be something that someone could look at, and it could be helpful for some people, I believe.
Yeah, awesome. And I think Terrell, I believe, asked the same another question. So, and I think this is maybe just like really obvious, and maybe for a lot of people who've never tried or experienced, like they just want to know, like, what does microdosing feel like? Like, what's the sensation?
Yeah.
How would you describe that?
So the idea of microdosing is a subperceptual, like, so you don't want to feel anything actually, and that's where starting at that low dose and going up week to week or each dose to see until they start feeling something, and that's where that journaling and mindfulness kind of come in, because if someone's having some of these side effects, like they're not so pleasant, such as the nausea, the lower dose might get rid of that. But as we do the microdosing and feeling that connection around us and seeing things a little bit differently and feeling the connection with others and having the lift, like some people have even referred to as the taking the line off of the eyes, the blinders, it can
Hmm.
help reduce that.
Hmm.
So it's really a low dose. Subperceptual, because if someone's feeling a high dose and in a board meeting and all of a sudden their boss walks in that has a dragon's head, that's not the greatest thing.
Yeah.
But I think that's where the journaling piece can kind of really help out to kind of be mindful into the approach of what am I actually feeling, what am I going um, overall. And I think that we need to kind of also think about with macrodosing might have a better, longer effect, um, more of a blast off when we start thinking about it. But some people can't handle that, and that's where the
Hmm.
microdosing might help. But I would love to see some research coming out with people who are doing macrodosing and with those all those connections that are happening. And then if someone's microdosing afterward, does it keep those pathways open?
Hmm.
Now that the gate's there, does it keep it moving longer? Which is, there was a study that came out with earlier this year with Furbersh and if anyone looks at Remap Therapeutics, which, disclaimer, is a company I'm working with, they do a lot with pain reduction and micro and macro dosing sessions. There's some great research on that website, in that has all of the papers that have been recently published, and they did that with some chronic pain. I think it was 3 or 5 participants that did macrodose and then held on with microdosing and kept that pain reduction for longer periods of time.
Wow. You wouldn't happen to have that link that we could drop in, or maybe, I guess we could probably include at the end of once we repost this webinar.
Yeah, it's Remap Therapeutics, and I can give that to you to put into the thing.
Perfect.
Or if you want to put it into the chat, it is REMAP Therapeutics.
All right. Okay, I'll throw that in right now. Awesome. Wow, this is great. Let's see. Just going through some of the. So I think Gabe. Okay, so I think 2 questions actually. So Emily asked, and by the way, Emily, shout out. She's the awesome rock star that's been pushing out some incredible Terrashroom content. So definitely say hi, show some love to Emily. But she asked, I'm curious how caffeine would interact with microdosing. So what do you know about that, CJ?
So some of the big, and I'll mention caffeine, but I'll also with that talk about the psychostimulant medications such as methylphenidate, Adderall, things like that. Because of the effects that psilocybin can have, that have stimulating effects for most people, really recommend people might want to watch their caffeine intake, because they potentiate each other. So 1 + 1 sometimes equals 3. So if someone gets more anxious, more nervous, more jittery while they're microdosing, and they're having, their standard 3 cups of coffee that they might have every day, they might not need 3 cups. They might want to go down to 2, 1.5, doing half calf instead, the tea, whatever, because they can potentiate each other in that manner. And that's the same conversation I have when I start someone on psychostimulants too, is, if you're a half a pot of coffee drinker a day, you might be doing that because you're self-medicating. You might not need that much. And this might be a different way of going about it. And kind of that's where the journaling piece and kind of realize what's going on. So if someone starts microdosing, they feel anxious and they've been, consuming the normal caffeine, it might not be the medicine that's causing the jittery and anxiety. It might be the two going together, and maybe looking at cutting that back a little bit, or doing tea instead that's got a lower caffeine intake, in which they could end up putting a microdose in with their tea. Or there's plenty of companies out there that do the mud waters and mushroom coffees and stuff like that. That could be, it might have that lion's mane and the turkey tail and all the other adaptogenic mushrooms. And they might work wonderfully together doing a stack like that.
Awesome. Yeah. A lot of great points right there. And I totally agree. I know personally, like, I've largely cut out coffee and replaced with like mushroom coffee. And it's to anyone who might be wondering, strongly recommend, especially if you might be like more on the ADHD spectrum.
And matcha coffee too. I've heard of really good matcha teas. Hearing some really good, because it acts differently on the caffeine, so it's a little less stimulating too for some people.
Definitely good to know. All right. Okay, so I think Gabe did ask one question that maybe a lot of people who have experienced, we'll just say maybe microdosing or like a full trip. So Gabe asks, is there anything to take in conjunction with psilocybin for those that feel depression at the end of a larger dose trip?
Oh, like the Monday morning blues.
Yeah,
I would say, part of it, I would say, from that letdown is maybe looking at doing some microdosing in there, maybe some of the journaling, kind of, the integration piece that's there, taking some of it, supporting yourself, being hydrated after that, making sure you get plenty of rest, because one of the effects, especially with the macrodose, is sometimes sleep is not not a priority or not able to be done if someone does a high dose, especially later in the day, and they can't sleep. And any ways that they can do that. Sometimes the could also be helpful to in planning ahead. Like, I'm going to be doing, if someone's like, I'm going to be doing this weekend, maybe taking Monday off as well to kind of incorporate that and kind of rest and heal. And don't underestimate the amount of the effects that can happen and what can arise and just settling. Because if someone's got great insights that they've gained from doing that high dose, and then going into a job that they don't necessarily love or don't feel their calling, and feeling out of sorts, out of place. And oftentimes you can't talk about those things that you've done over that with other people, and feeling that lack of community, you don't feel supported. So like taking that time to really feel that connection before you go in, taking that time to really take into consideration the other factors around you.
Yeah. Okay. That's a great answer to that question. And I think the one last question we really have before we start getting to the giveaway side of things. So Rachel asked, is 5-HTP wait, comments are moving. Sorry. So is 5-HTP contradicted as post-macro journey care?
If they're going to be doing that alone, it would probably be okay. But if someone's on top of, like, the I'm assuming the the 5 HTP would be something like the not lion's mane, St. John's wort, and the naturally herbals that are all work on the serotonergic system as well. With that, yeah, I think, give it a maybe, that might be something you could do, but be mindful if they're on other things that are there, that wouldn't be good. Adding the 5T with other standard SSRIs, things like that. But being careful of that. But I did do, when I was trying to figure out some of those, the 5 TP and also St. John's wort, trying to find some interactions, and there was nothing there I could find in writing my book, the Microdosing Guidebook, that would be there. I couldn't find anything. But also, so, to extrapolate down, like, it works in a manner that's similar to the antidepressant medications. So theoretically, at least, it shouldn't do anything like that. I would be more mindful of mixing those with antidepressant medications, but with microdosing or macrodosing, it should not be as much of an issue.
Gotcha. Well, and I think speaking on that, so Elizabeth asked one question about as a basically, so mushrooms as a supplementation to ketamine treatments.
I think it would be great. I mean, I don't see a problem with that, because ketamine works on the glutamate system, which is the NMDA receptor. Same thing as nitrous oxide as well. And yeah, that's completely different receptors, completely different thing. And I think that would be would not be it would not be problematic to do it, and it should not block any of those effects. And either way, so I think that could be a part of it. And I would say is you might want to just figure out, if you're doing a protocol and doing it every couple of days, looking at what are you doing leading up to it. And maybe I wouldn't say you probably don't want to do it on ketamine day, but maybe if you're going to microdose the day before or something. It also depends on the dose of ketamine. If someone's going to be doing a high dose versus a low dose, that's going to be for more therapy. But if you are doing it, I would definitely share with your the provider that is doing the ketamine that that's what you're doing, and they might have some additional ideas and thoughts as well. But I would talk to them about it and see, what do they feel? Because there's other supplements out there that can help with ketamine specifically that they might know about too.
Okay. And let's see. Yeah, I think we got a lot of some follow-up. And quite frankly, I was going to say, so we are about 10 minutes over, and we still need to talk about giveaways and basically announce the winners of that. So if you do have questions, we are going to be doing the part 3 series to this microdosing webinar next Friday, same time, 2 p.m. Central. So We'd greatly appreciate it if you could save some of these questions, just because, quite frankly, we got a lot of questions, not a whole lot of time at this point to go over. So
2 weeks, 2 weeks. Like not
oh,
not
that's
next
right.
Friday, Friday after. Yes.
Yes. Yeah. So yeah. So my apologies. The following Friday after this upcoming. But that being said, yeah. So let's talk about some of these giveaway winners. So as I mentioned, number one, we are going to be giving away a signed copy of CJ's book, the Microdosing Guidebook. I put a couple comments in the chat to that. So yeah, here it is. And just so people are clear, this is something that, like, people order it. It's getting delivered now. Is that correct? I think I saw something about a pre-order, or what. Can you talk about that a little bit, CJ?
The pre-order, or what do you mean for the book?
Yeah. Just
book is available everywhere that people get their books, including you can go onto Amazon. Leaving reviews on Amazon is super helpful because it helps with their bringing it to the forefront. But it's available anywhere. I really encourage people to go support small businesses. I really feel that is a great asset that the bookstores have, and chances are, if you go, because they can get it through Simon & Schuster is doing distribution. So chances are, if you go to a small bookstore to get it, if you order it, they're probably not going to order just one. They'll order 2 or 3. They'll put it on the bookshelves to get the word out there. So I appreciate that. All you can. So yeah. And if people end up seeing the book in the wild and want to go on and tag my Instagram at EntheoNurse, tag me where you find it. I'd love to hear and see. I've had a couple of friends send me that they've seen it in both in New York City. A couple of people in Norway have seen it, things like that. So it's really it's cool to see where it's going. So yeah, please ask.
Yeah. I was gonna say, yeah, let's any wild spottings of the Microdosing Guidebook, please send those sightings to CJ's Instagram. That'd be awesome. Cool. Well, let's so here's the thing. We have this super sophisticated method of selecting winners, and that is basically just in the comment section, we're going to scroll, we're going to pick someone for the winner. We did, to be clear though, we do have a raffle entry for the Terrashroom Mega Giveaway. So basically what we did is that was, for every entry, that was in an Excel spreadsheet. Vince basically wrote an algorithm. With that algorithm, we basically selected the top, I think it's 10. And so we're doing a live spin on that wheel, just because as people pop onto this webinar and stay till the end, we're not able to do that same thing for the live participants on this. So we're going to start off with number one, the signed copy of CJ's book. Number two, we're doing a Terrashroom hoodie. And then number three, this is going to be, we're going to be announcing the giveaway for the Terrashroom Mega Giveaway winner, which is a Terrashroom Grow Chamber, 3 months of grow cakes, and then as well as we're going to be doing some swag. So, all right. So if you are still listening to this and you're still on, basically just plop your name in the chat, plop sticker, favorite part, basically just something. So I'm going to close my eyes, scroll at random, and pick a name. So do that for the next 20 seconds. Jeopardy music is playing a little bit in the background as we wait, and we'll get this going. And CJ, show your book again so everyone sees what they're looking at winning. All right, so this is it. Okay, all right. So we're going to do this in 5 seconds for the Microdosing Guidebook signed copy from CJ. Closing my eyes. 3, 2, oh, here we go. 3, 2, 1, and Christian Swartz. Congratulations. Let's see. And are you there, Christian? All right, Christian's there. Perfect. And he send us a DM. We will get back to you after this to send that over. And all right, we're going to do now. So congrats, Christian. We will get that sent out probably early next week or this weekend. All right, so now round 2. This is for the exclusive Terrashroom hoodie. Depending on what the weather looks like in your neck of the woods, this might be really useful. So, okay. 5, 4, 3, 2, 1, and Elizabeth Marie Wadsworth. Congratulations on getting a super limited edition edition Terrashroom hoodie. So congrats on that. Please DM us as well, and we will get that sent out to you as well. All right, so this is probably the big giveaway that everyone's been waiting for. We did, per giveaway rules and regulations, we did close off the giveaway. So we will be getting a new one up. So we will be doing grow chamber, 3-month grow supply of the cakes. And so Vince, if you can throw up the wheel, and we will get that spinning in just a second. All right. Okay, so these are our, oh wait, I think we need a, there we go. Okay, so these are our 10 finalists. The wheel has spun. And Nico, congratulations. We can't be giving out personal details, obviously, because there's like email and, you know, other stuff. So Nico, we will be posting this that you won. Congratulations. You can expect that an email from us to do that. So anyways, congratulations on the winners. Everyone stay tuned. So once again, not this week, the following week, we will be doing part 3 of this webinar series. Thank you so much for everyone that has come on board. Thank you, and once again, to the entire community, everyone that's supported us, backed us, showed up to these webinars, commented areas of support, encouragement. We are working a lot to bring this to life, and we just have a lot of incredible things in the pipeline. So excited to share more on that. CJ, anything you want to closing topics, discussions, anything wrap up?
Follow me on my social media and all of them. I don't have TikTok. I don't know that one. But it's at Entheonurse, ENTHEONURSE. All the other information is there. That's the big thing. So yeah.
All right. Yeah. So yeah, I was gonna say we have those up. So Facebook, Instagram, Twitter. Show CJ some love. He's been incredible. He's given us a ton of just incredible, valuable information. We will be reposting quite a bit of this content as well. So once again, thank you so much for everyone. You're incredible, and we will catch you soon. Have a happy Friday and a great rest of the weekend. Talk to you all later. Bye.
Much love, everybody.